This is WRFI Community Radio News for Friday, June 27th, 2014. I'm Caitlin Hara.
And I'm Maya Cueva. On Friday, June 20th, around 4 p.m., a truck trailer crashed into Simeon's restaurant in downtown Ithaca, killing 27-year-old Amanda Bush, a bartender at the restaurant, and injuring 6 other people. One particular local organization is starting to do work to try and heal the Ithaca community in the aftermath of the accident. And I am here today with Emily Nowels, a representative from the Mental Health Association in Tompkins County, to hear more about this work. Thank you so much for joining us, Emily.
Hi, thank you for having me.
So, what do you think this accident means to the Ithaca community?
I think Savante said it really well in the interview he had with the Journal, which was that Simeon's wasn't just a restaurant; it was sort of the entrance to our community, and it was the place where everyone met, and it is the entrance to the commons. It's something we've all spent a long time standing outside of, and so I think losing that wasn't just losing a member of our community. We were also losing sort of an emblem of the community. That's something we all related to in some way.
So there's no doubt that this is considered a traumatic event for many residents. And so could you just talk a little bit about some of the stages of trauma that people might be experiencing after this accident?
Yeah. With things like trauma, every therapist, and there's a million different things that people talk about. There's different stages. Everyone has their different stages that they go through. But kind of the 3 that always come up are safety, remembrance, and integration, and those sort of the 3 stages of recovery. So safety is, you've been injured and your control has been totally taken away from you. So first you have to be safe. What am I doing? How am I handling these situations? And sort of what can I do to keep myself safe? Everyone reacts very differently, and everyone has different symptoms when it comes to trauma. So, some people are anxious, some people have a hard time sleeping, some people may be very passive or not have any signs of trauma at all. Some people, it affects their eating, they may become depressed, really impatient, irritable, angry. It looks different on all different kinds of people. So that's important to realize too. So, every person's going to recover a little differently. And I think the first thing that's most important is that you recognize how you're responding to the event. And then you can sort of move through that. The next stage, they say, is remembrance, which is sort of, beginning to mourn and move through the loss of the person that you lost or the event. And finally, there's integration, taking that event out of the forefront of your life so your life doesn't revolve around it, but it kind of becomes a part of your story. So that's sort of the 3 stages that I see that are sort of an arc again, like across all of the different readings that I've done about stages of trauma.
So, and it seems that many residents might not even know they're experiencing these forms of trauma that you described. So I was also wondering what your work and role is at the Mental Health Association in Tompkins County.
Yeah, so the Mental Health Association, it's actually often confused with the mental health clinic. We're an advocacy organization. So all we do is try to spread the word about what mental health is and where the services are that you can get help. We advocate for the individual as well as for the group. So we do some advocacy on the at the state level when we go to Albany, and other times we advocate with the individual, which means someone will call, they're getting out of a hospital or they need help finding a place to live or finding a therapist. So that's the work that we do, is sort of play that middleman between the mental health consumer and wherever it is that they're trying to get help. So after this event, we all kind of sat down and talked about it, and we really are just trying to make sure everyone realizes that we're here to help them find what's next. And a lot of other organizations in the community have really stepped up to the plate as well. And Suicide Prevention and Crisis Services is actually offering free counseling for anyone dealing with this traumatic experience. So you can call in and get an emotional checkup through sort of a short conversation, or you can schedule an hour-long appointment and then schedule up to 7 more appointments after that, and that's free. And that's through Suicide Prevention. And when you call, you can ask for Sheila McHugh, Monday through Thursday. And that number is 607-272-1505. And that's like a really great way if you don't have a lot of money and you're dealing with this trauma. That's a great resource that the Suicide Prevention and Counseling Services is offering to the Ithaca community.
And with the aftermath of this accident, have you seen or have you had more people come in to the Mental Health Association, or what do you think is happening post?
I don't know if I've seen... We've had a little more phone calls. We've had a lot of people calling in. So the main thing, a big part of what we do for the community is people can call us and say, I'm looking for a therapist. And I encourage anyone that is feeling any sort of aftermath of this trauma to go ahead and give us a call. And even if it's just to know what resources are available, we can give lists of support groups in the community, and we can also give you names of therapists. People call and they might have a specific insurance plan or might be on Medicaid, and we can put you down the right avenue to get the help that you need. So that's sort of, we've had a few more calls. Sometimes people don't want to tell us why they're calling, and that's totally fine. So it's hard to tell why exactly they're calling, but yeah, I'd say there's been an influx in people reaching out this week, and I expect that to continue into the future for a little bit.
So have you seen any skepticism around what you guys are working on, or does it seem like everyone is on board?
I don't know. With this particular event, I would say no. Because, one thing that's so beautiful about the Ithaca community is how we can sort of come together and all take care of each other. And that's been, so beautiful with the Amanda Bush Trust Fund that was set up by the United Way. And there's now a movement to set up actually a fund to help just Simeon's employees who lost their job get treatment and get therapy. There's a whole movement and push for that. So this community is really, I think anything that these people need or anyone that was affected, the community is really going to support. Skepticism around mental health, that's been there for years, I think. So, might be a different conversation.
Well, thank you so much, Emily, for joining us today. And is there anything else you would like to say?
Yeah, that would be great. Actually, we are doing a lot in the upcoming month. We're going to be a part of Gallery Night, which is July 11th from 5 to 8, and we'll be at Autumn Leaves Bookstore. We produce a magazine, so that'll be our release party for that magazine with art and people doing live readings. And we're also going to be doing a movie night at Cinemapolis, and we'll be screening Silver Linings Playbook. And that will be July 23rd, which is a Wednesday. And we'll have a therapist come in and sort of lead a discussion about stigma surrounding bipolar disorder as well as other disorders. So that's going to be a really awesome event. And like I said, if anyone needs or feels like they need any help about this event or just wants to talk to someone, feel free to call the Mental Health Association, and we'll be happy to point you in the right direction.
So could you just provide, just for the listeners, once again, if they would like to seek this information, where they should go and how they can contact about these services?
Yeah, so anyone can call us at the office, and our number there is 607-273-9250. And then we also have resources available online, which is through our website, which is www.mhaedu.org. So,
all right. Well, thank you so much, Emily. It was a pleasure talking to you today.
Thank you.